Dear students, those who are viewing this screen and program, I would like to give you some information and knowledge and introduction about that. What does importance of the theory examination in the PG examination? Most of centers I have been seen, then theory papers are checked by the some another examiner, while practical examination is held by some another examination. But in certain centers, still the theory and practical are conducted by the same examiner. So in that way, the preparation and the importance of the theory paper and theory examination become more and more and as equal to as the practical examination to clear their PG exam. And I have seen the number of cases in the theory examination, theory papers. Almost I have passed the near about 250 postgraduate students from my self center, SMS Medical College Jaipur, and my previous college Kota and Ajmer and Bikaner. And so many exams I have been taken across the country. What did I find in the theory examination? Where the practical examination is going along with the theory examination, or the theory checked there, student take it very lightly. But where the theory part is checked by some another examination, say for example in the DLV exam, it is very important. And without passing the theory practical, they cannot sit in the practical examination. And to pass both the examination equally important. If you fail in the theory, you cannot pass the practical. So the preparation for the theory examination is very must. And the preparation for theory examination, one thing is most important is this: selection of the books, attending the lecture of your teachers, attending the seminars, webinar, and the conferences on the various topics of the theory. In that scene, I would like to suggest you that you have to never go from the shortcut way. Read standard textbook only, no shortcut, because this is the final degree of the orthopedic. No other degree above the orthopedics in India at least. I give you my one experience when I was examiner at the Surat Medical College. And there were 7-8 students. When the students were not replying in a proper relevant way, of course they were replying, they were giving answer in some mixed picture, but I was not satisfied. Ultimately, I asked them, can you tell me, dear students, that which textbook do you consider to read for the theory point of view, theory purpose? They give me the name of the books that was I have not heard in my practice, in my career, but I give the name that, do you know Watson Jones' book? What is this book? Particularly for what section of the orthopedics? Out of 7 students, only 3 students replied that yes sir, we have heard about the Watson Jones book of the orthopedic, but they do not know how many volumes of these books are there and what kind of books it is there. So I became very shocked to know this thing. I don't want to disclose what happened later on, but the standard book for the reading as a whole complete, so-called the Gita of the orthopedic, is the Campbell. If you read the Campbell, I can challenge you, you does not require the any superlative degree beyond the MS orthopedic. But what happened? Most of students see a limited text, limited topics, limited techniques, limited procedures from the Campbell. But I am sure, I can assure you, if a student read this Campbell in toto as a whole, I can guarantee nobody can challenge him in his field over the world. And it doesn't require any degree more than this if he reads really. And regarding the trauma section, if you want to see what is the management of the trauma, what is the etiology of trauma, and what is the protocol of the trauma management, Then you have to see the another book, that is the Bible of the orthopedics. That's the Watson Jones fracture and joint injuries. And if you cannot see this book, means your orthopedic training is incomplete. The language of this book is very sequentially and very understandable. Every general student can understand it. But many centers, many students have not seen the picture of this. I am surprised, I am shocked to know this thing. So what I want to say, to read the standard book for the theory preparation, you must read the standard book. There might be some another book, but these are the books which are well known and well appreciated worldwide. And when you go to the general orthopedic reading and the topics comes in the general orthopedics for a separate paper, then there are so many books. But if you say, sir, I have read the Samuel Torre, every examiner, every teacher will create a picture about your preparation, that really you are the brilliant student, you have read something more in the orthopedic. And I am sure if you all these three books read, I can guarantee nobody can fail. All these three books, one is the Gita, another is the Ramayana, one is the Bible or Quran of the orthopedics. If you read these three books, I am pretty sure that you will be 101% success in this field. Now, how do you read? These are the standard book. How do you read and manage the case post-operatively or after conservative management by giving the appliances, traction, and physiotherapy and exercises? For that, you need one another book, that is the Steward. When I doing my postgraduation in the year 1983, at that time the first volume of this book came in the market. I read it thoroughly. It was very excellent book for the physiotherapy, rehabilitation, post-operative management point of view. And now I think many medicines has been come in the market, and so many other books regarding the pediatrics. Serad है, या आपकी Stewart है, and other Rockwood है. There are many and Mercer has so many books, but these four books are enough for your purpose. You will not disappoint by doing study from these books. So friend, go through the previous year questions paper to understand pattern and importance of the topics, so that you can read accordingly from these textbooks. If you do not see the previous papers, you are unable to get what I have to read, how I have to read, and what is my aim and target of this reading and theory preparation. And the next thing is this: when you sit in the examination, what I have to write. I have seen many copy. I do not know that the student how they are writing in the copy. Many students, even that they do not write the question number. Let's say, for example, if a question comes, classify and describe the Perthes disease. Question number 2, they say, they start writing, but they do not answer properly. First, how they have to write it? They have to write question number 2, prescription about the Perthes disease. Then they have to start it. And how do they start it? That you have to first give a general introduction about the Perthes disease, then scientific background of the Perthes disease, then go to its etiology, investigation and management, investigation, treatment and management and follow-up, and its complication. Many students get confused in the what is the treatment and what is the management. If I would like to explain you, say for example, the question comes, management of the Pott's spine. What does mean by management of Pott's spine? many students get confused. Management means investigation of the patient with its proper treatment. That is the management, that we have to manage the patient in toto, from investigation to its treatment aspect. After that, the complication and the post-operative follow or post-treatment follow-ups come. So the first learn, listen, understand what is the examiner wants from you. Well, that management, and then divide time accordingly. Suppose if 4 questions are come there and you have only 3 hours, 3 hours. So in these 3 hours, you have to divide 45 minutes to each question. Never expend your maximum time in the first question. I have seen the many students, they expend the maximum time, even that beyond the 45 minutes, up to the 1 hour or more than 1 hour in the first question. And then they start the second question and take the second question for maximum time. And the last 3 and 4 questions, they roughly do very fast. Sometimes they giving and sometimes they are not giving the copy after finishing of the time, and the examiner says the copy. So a proper division of the time to solve the question is must, and you have to keep in your mind that I have completed my 45 minutes. Similarly, as a lecture in the conference, the time awarded is fixed 8 minutes for speaking and 2 minutes for the discussion. Similarly, you have to divide the time for attending the question. Out of 45 minutes, 40 minutes to answer that question and 5 minutes to check that question. That is there is any connector, is there is any problem or any if there is any question or problem problem that it is not written properly or need some ये काम नहीं कर रहा गया आता रहा नहीं आ रहा गया क्या?
Yes, I think Dr. MEENA has come back.
Yes sir, I am sorry.
Yes,
Actually
sir,
battery down हो गई थी.
Correct.
So can I ahead? Go ahead.
Yes, sir. Please.
Yes, sir.
Please go ahead, sir.
Yes, sir. So the main important thing is to divide the time according to the need of the question, and similarly, that time is most important. So next thing is the papers of the PG examination. Though there is definitely clear-cut demarcation for the papers. The paper 1 is the basic science and applied to orthopedics. But nowadays I am seeing, when I am checking the copies regularly nowadays, and I am setting the paper also, I follow the rules regulation, but I do not know many of examination why not it is following, or it is some typing mistake. That in the first paper, basic science, the paper of the trauma, the questions of the trauma are coming, the question of the general orthopedics are coming. But anyway, the system of the paper is like this. In the first, it may be varied from university to university, but the general system is this, that it should be first paper of the basic sciences as applied to orthopedics, and second paper of the traumatology and rehabilitation, and third paper is general orthopedics, and fourth paper is from the recent advance in orthopedic surgery and general surgery as applied to the orthopedics. So according to paper, you have to read the books. Of course, during the 3 years you have read all the books, but for the examination within 2-3 days you have to come according to these syllabus. So friend, my next topic is talk is on the history taking after giving your theory examination. And one important talk I listened from the Rajgopal, that you should not left any question unanswered. You have to answer each and every question, because you are not so intelligent that the left question can be compensated by answered the another question in a good spirit. So, and you know the answer of all the questions if you have read through the 3 years. So next talk is on the my how to take the history for the practical examination. That is an important tool for a PG students during the practical examination. So friends, the history taking is very important tool is creating a rapport and reaching the differential diagnosis and management of patient. Again, I insist the management word that can be solved by the history taking. First, you will ask the patient, then you will think in your mind a diagnosis, then you will confirm your diagnosis by doing the investigation, and ultimately, then you will reach to the management. So, the importance of history taking is a tool creating in between a tool creating a rapport and reaching differential diagnosis and in management of a patient. First, you have to ask the chief complaint, not relevant complaint. वो दबा ना वहाँ से अच्छी तरह दबा दो. हाँ. First, you have to ask the candidate about a chief complaint, not irrelevant things. So, if you ask the patient about chief complaints, what is bring you here? Say, for example, patient having lurching gait, but but he having lurching gait. Why this lurching gait develop? Means in the chief complaint, ask the patient ended question like, what bring you here? Gentlemen, आप यहाँ क्यों आए? क्या प्रॉब्लम हुई आपको? पेशेंट कहेगा साहब मेरे से फॉर एग्जांपल मेरे कमर में दर्द था, इसके बाद में पैर में कमजोरी आ गई, मैं लचकने लग गया. मीन्स ही हैविंग सम अनदर प्रॉब्लम हेयर टू इसमें इसमें करके रहा था किसमें हाँ ही हैविंग प्रॉब्लम somewhere else rather than in the hip. Lurching gait is not only the sign of the hip joint problem. Similarly, how can I help you? So that he develop faith and confidence in you. And then initiate your questions by introducing yourself so that patient become fully satisfied and comfortable with you that really you are his well-wisher and really you are a consultant and the best doctor in today's scenario. And then create a rapport in the patient and you, in between the patient and you, and the history of the present illness. Here I would like to explain to the students that when the everything is present in today's digital world, everything, even that the CT scan, PET scan, MRI, biopsy, and the blood investigation, I ask this question many times from the many students. What is the
क्या प्रॉब्लम आ रही है? किसका स्क्रीन आ गया?
Right, sir?
स्क्रीन नहीं आ रहा, सबका चल रहा है.
मेरा क्या है? मैं एग्जिट होके दोबारा एंटर करूं?
आप एक्सिट होकर दोबारा एंटर
Manish, Manish, unmute yourself, Manish.
Should I continue?
Sir,
Yeah,
please
sir.
continue, sir. You are
Okay, sir.
going on.
So, students, if you are hearing me, what I want to say, why I asked one question. I asked this question during the history presentation. Gentlemen, you are asking the long detail about his illness. You are asking about the onset of your disease and so many things. But why, when we having in 2 days, but everything's on the Google market, what is the sense of this? Means we want to see the talent in the student, that he knows how to satisfy the patient, how he can develop a rapport in the patient, how he can develop confidence in the patient. But in the past, many years back, when all these things were not easily available, neither there were MRI, nor there was facility of the biopsy, and it was very far away things for the PET scan or other ISC or many investigation or viral investigation. In that scenario, this history taking, this clinical examination of the patient was very important to diagnose your case and manage it. But none of the student was able to reply in this manner. They were just saying, sir, it is our syllabus, our teacher said that examine the patient, but he do not understand why you are doing this. Means you are proving your talent, you are proving your capability to develop with faith in the student and caliber. So now history of present illness, friend, avoid the medical terminology. One thing. Second thing, use a familiar descriptive language. Say for example, if a student of South come in the Rajasthan, particularly in the area of the West, North or West Rajasthan, where even they do not know proper Hindi of the Rajasthan, East Rajasthan. So in that circumstances, you have to develop a skill or language in yourself. In his language, you can ask the question. And if you hesitate, if you do not know, then you can have an interpreter. But you have to take the history properly and avoid as far as the medical terminology. And there is no best way to question a patient. Definitely, several broad questions are there. What are these? The duration of your illness, severity and its character, and rate the problem 1 to 10 as described. Pain, sleep, ADL affected, location and radiation of the pain, pace of illness, better, worse, same, rate of the change, associated with any other symptoms. Have they had any treatment before this? And why today you are here? So old card that solve your all these problems means onset of the problem, location and radiation of the disease, and duration, since how long, since when, and the nature of the problem, that is character, and aggravating factor, the present illness, and the relieving factor of the present illness, and timing at what time it gets relieved, at what time it gets worse, and at what time it remains same, and the severity, intensity of the pain, whether it is severe or when. So, while taking the present history, gradually establish the differential diagnosis in your mind. Gradually narrow down, then focus on the physical science so that you can reply a better way and have a solution in your mind already the before examiner asks the question. So go to the past medical history, a similar episode, hospitalization for any kind of problem or associated medical problem. And if there is any past surgical history, say for example, patient coming to you for the spinal deformity, is there is any history of the abscess drainage for the cold abscess, or patient coming to you with the nursing gait and the hip deformity, for that a past surgical history of doing any spine surgery like that, operations and complications, and then medication or drug he has taken for the same problem. What kind of drug it was, how much dose you are taking, and frequency of the treatment. Say for example, drug. Patient say, I was taking the drug in the early morning. After that taking, I used to pass the color of the urine that was there. That means he was taking the rifampicin that pass in the stool, urine and the secretions, and frequency similarly. And regular treatment or not, that gave rise you about the resistance and reminiscence of the disease and its side effect, that most of TB drugs produce the ototoxicity or allergic manifestations. So do they, why they are being treated, and non-traditional medicines, self-administered medicines, if they have taken, whether it's alcohol or tobacco chewing, that create the gastric problem and liver problem, and the tobacco give rise the oropharyngeal problems and the brain stimulations and allergy or reaction to something like that. And a family history is also very suggestive that include the similar kind of problem in any family member. And then ask the consanguinity and the contact with the TB patients or in the surrounding area or pass through a similar area. And the other relevant histories are occupational history. You are need not to take this kind of the occupational history in much detail, but you have to take these points. So make a summarized consensus for the diagnosis. And the socio-economic status of the patient definitely have a matter. Then hobbies of the patients. A player can develop some another problem, just a sports intelligence, and the expectations of the patient from you is also important. So in that way, the history taking is a skill which increase with the time, practice, practical exposure, and knowledge of yourself from the standard books and attending the classes regularly, seminar and webinar, conferences, and see the patient very sincerely in your day-to-day life during the operation theater, during the ward round, in the OPD, and ask your teacher for the same. So friends, do not give up. Normally, it is the last key on the right which open the door. Thank you very much.